Climate change is already causing significant health effects on humans, especially the more vulnerable. Dr. Jim Shames, Medical Director for Jackson County Health and Human Services since 2002, is already strategically addressing the interrelated systemic effects of climate change on the health and well-being of the Rogue Valley communities.
There are a number of effects that are projected health-wise as a result of climate change, and we've had a week of really severe smoke and air quality problems because of the wildfires that we are having this year. What are some of the effects that you think will happen as we go forward and they become more severe and more frequent, as many scientists project?
Right. Where the thing to remember about air quality is, those who are robust, disease-free in the middle of their lives often can tolerate small particulate matter. They have a little bit of a cough, or the heat. They have good sweating mechanisms. They're able to manage the climate-related changes more easily than the more fragile among us. So newborns, people with chronic illness, people with heart disease, lung disease, the elderly, they don't have the same degree of reserve. So weather like this that we're having right now, with poor visibility and lots of small particulate matter, it makes it hard to breathe.
Mm-hmm.
Folks have a hard time being outside. It really restricts the kind of life they can live, the quality of their lives. That is an absolute consequence. And if you project forward and you say, well, we're going to have more of this for more months out of the year, and it's going to be more intense, it will greatly impact not only people's health, but the kinds of lives they get to live.
Mm-hmm.
You can't go out and exercise and appreciate the natural beauty if it makes you cough and wheeze and causes chest pain.
Mm-hmm. The increase in algae blooms that we've been having in some of the lakes locally, they've become more frequent, and it seems like they're taking longer to dissipate. But what do you see happening going forward with those in terms of human health?
That is one of many examples of what's going to happen as the waters get warmer. Algae will grow more abundantly. We get nitrogen runoff from fields that will fertilize them, so to speak. Some of those algae are toxic, but there can be definite health effects, and there probably will increasingly be bodies of water that we can't drink from as a result of that. Mm-hmm. And these are things that are going to affect the fish, and the change in diseases, the change in the animals that can live in a particular
mm-hmm.
environment. Just a few degrees Fahrenheit change will have profound effects, and one thing leads to another. The algae blooms may be an annoyance to us, but it may be fatal to other
mm-hmm.
animals within the larger ecosystem.
One of the concerns that isn't really necessarily a direct health threat immediately, but is something that is a concern with some officials and scientists, is disruptions in the food supply with increasing droughts, torrential rains, loss of farmland, and with the really extreme storms, effects on the distribution network that we have to get food to people. What do you see its effect being in combination with some of these others on people's health?
At public health, the entire county is really my patient. And so we do need to think about the socio-political, economic effects, because they affect the health of the entire community.
Mm-hmm.
So all those things you mentioned are vitally important to consider if we want to look ahead the next 10, 20, 50 years of the well-being of the citizens
mm-hmm.
of Jackson County.
Mm-hmm.
So, yes, what kind of food are going to be available to us, what's going to be able to be grown here locally, how is it going to, how are the foods that we need going to get here, the climate changes in relation to pathogens, people moving here, getting hotter, the air getting smokier, all those issues we have to put into the mix, and they're all going to affect the well-being and health of Jackson County. So I guess for us, what is already happening is that we have air quality issues and we have heat-related issues, and if the pattern of less and less water being retained in our aquifer continues, we're going to certainly have difficulty with agriculture, just having water to drink. I'm not a climate scientist. I don't know what all the modeling tells us, but they're all going to have public health effects.
You'd like to make. Is the county working on any plans, as far as you're aware, to cope with some of these projected problems?
We do talk about climate change. We've had conferences locally, and we've gone to others where we've looked at the public health consequences of climate change. But we kind of rely on folks like the CDC and the Oregon Health Authority and others who have more resources to help guide us in those areas.